Back on Dr. Dolly, your show. Thank you all for tuning in. 1-877 Doc Dolly, 1-877 DOCDALI. So all eyes are watching now the Texas, now that the Texas primary is over. And we are looking at Texas State Representative James Tallarico going to be up against Attorney General Ken Paxton as it pertains to the upcoming Senate election. This is going to be a very, very expensive election in a state that isn't really supposed to be very controversial or a battleground. And you are seeing James Tallarico try to now walk back some of the comments. He said some of his previous comments, quote unquote, missed the mark, such as Jesus being non-binary or the Lord being non-binary, and saying that there are 6 genders. Let me see if I have his quote on that. I remember speaking about that. Oh, yeah, he said there were 6 sexes. This was back in 2021. And it was during a committee on public education where he said, modern science obviously recognizes that there are many more than 2 biological sexes. He says, in fact, there are 6. He says, which honestly surprised me too, because I'm not well versed in this issue area. I'm not a scientist. I'm a politician, a lot worse than a scientist. And so we were wondering what the hell he was talking about. And so what I think he was trying to stretch were the different chromosomal combinations, where if you have XX and XY, those aren't the only 2 combinations. There are a very, very small subset of patients and populations that may have 3 X chromosomes, 2 X's and a Y, like Klinefelter's, or the 1 X and 2 Y's. And so then apparently he had a 2013 blog post where he discussed multiple sexes based on their carrier type. You got the Turner syndrome, which is just X. You got XX, the most common form of female. You got Klinefelter, which is XXY. You got XY, which is male. XYY and XXXY. Okay, well, the latter 2 are very, very rare. Turner's is rare. And so it doesn't, even in medical literature, if you just have an X chromosome, we refer in medicine to Turner's syndrome patients as female. Just like with Klinefelter syndrome, XXY, having an extra X chromosome could affect testicular growth, testosterone production, and fertility. But those with Klinefelters in the medical literature are still referred to as male. Jacob syndrome is where you have XYY. You possess an additional Y chromosome. It could affect your height, your motor skills, your speech, behavior. Does not appear to affect the penis and testes. So these individuals are, again, considered male. Those with XXXY or XYYY karyotypes and other combinations could have a variety of developmental and fertility challenges. And then you have the intersex individuals, who we used to call hermaphrodites, which have both sex organs, male and female. And usually we remove the testicles that are undescended. That could unfortunately become cancerous and not without anybody noticing. And so for their safety, we remove the testicles. Many of them, if they have a vagina, they will then be raised as a female. Those are more common. We have about 1 in, I think, every 1,000 people is intersex. And so there's more individuals that could have that. But again, we at birth, based on the anatomy and the ease for them to be accepted into society, and we usually will raise them as a female, although they have a choice, later to become male if their testicles have not dropped, and those are usually removed to prevent there being cancer risk, because for testicular cancer you need to be able to watch and feel for lumps, and so and undescended testicles could be at higher risk for cancer. So those statements that he was, making was a little uneducated, but I understand he was trying to appeal to Democrats and trying to appeal to the rising base that does not agree with there being male and female genders. So, in an interview with NBC News, he wanted to clarify some of those statements that his challenger Attorney General Ken Paxton, who got Trump's blessing and Trump's endorsement, then sailed to win the primary against Senator Corwin. But what Tallarico said was, I'll be the first to admit that I missed the mark on some of those old statements. But what Ken Paxton is doing is clipping my cringy comments to distract from his career of corruption. Now, I believe Ken Paxton was acquitted of any charges that he had. So I think, it's going to get ugly. It's going to get very, very ugly. Apparently, Ken Paxton refers to him as Tofu Tallarico. Is he vegetarian? Is that why? I wouldn't do that because a lot of people like tofu. Six gender Jimmy, James Tallarico, he calls him low T Tallarico. And I would not go there. You really don't have to. You have good policy. If you have good policy, Tallarico has, said being white skin gives me and every white American immunity from the virus of racism, but we spread it wherever we go through our words, our actions, and our systems. He says we don't have to be showing symptoms like a white hood or a Confederate flag to be contagious. So basically he was saying that all white people are racist. That doesn't help, especially when, you had President Obama who worked with Biden and other white individuals. I mean, we work together. That's you're trying to say that, well, if you're white, you're automatically infected with a racist virus is not correct and ridiculous, and it hurts him and it hurts Democrats. If he's a vegan, I don't mind that. Let him be a vegan. I mean, Republicans should not be mocking him. You don't have to. You don't have to mock personality traits, or you don't have to mock certain things, because then you're going to upset other vegans. And everybody thinks, well, vegans are Democrat anyway. No, a lot of people have been going more vegetarian and then vegan, cutting out all animal products because they, for health, don't really need to be, the one thing that the Republicans have been arguing that the Democrats have been is that the Democrats have been very discriminatory. So Republicans can't be then doing that. They can't be, discriminatory as well. But the big concern that the GOP is having is this was one of the most expensive primaries. And now, are they going to have enough money? I mean, I think the primary cost $130 million. And so it hasn't even now gotten started yet. And the money that Tallarico has raised is much more than the money that Ken Paxton now has by a few million. I think, Representative James Tallarico has raised more than $40 million. He spent a lot of it in the primary, but they expect him to raise more. He pulled in $600,000 2 hours after Paxton. Now, even though Tallarico was able to raise $40 million, he spent a lot of it. Paxton has raised $7.6 million. After the primary, he has $2.3 million left. So it's not enough. And Texas is a very expensive state. They have roughly 20 media markets. Statewide ads can cost several $1 million to air each week. This could be pulling funds from battleground states. So it is a concern. I'm just surprised that people think it's going to be close. I don't see how Democrats would like Tallarico. 1-877-Doc-Dolly. Don't go away. Hi, everyone. Dr. Dahlia here. Thousands of physicians, residents, and medical students are silently dealing with depression. And tragically, 400 take their lives each year. 400! I wrote The Depressed Doctor, hoping to reach out to anyone struggling. You're not alone. Don't stay silent. The Depressed Doctor can be found on Amazon, or the Depressed Doctor book can be found on drdahlia.com. And if you or anyone you know needs help, call or text 988, the National Suicide and Crisis Hotline. Don't suffer in silence.
Increase fuel economy up to 7.9% with Hot Shot's Secret Gasoline Extreme, the solution to maximize your engine's performance and fuel economy. Whether you're driving a sports car or a daily commuter, Gasoline Extreme is specially formulated with PEA to deep clean. Don't settle for an average driving experience. Upgrade to Hot Shot's Secret Gasoline Extreme and go further on each tank. Order now on Amazon or HotShotSecret.com. Hot Shot Secret, powered by science.
And we are back on the Dr. Dahlia Show. Thank you all for tuning in. 1-877 Dr. Dahlia, 1-877 DOCDALI. So Ebola is spreading, and we are concerned. Is it going to be to the degree that the 2014-2016 epidemic was that killed 11,300 people? We don't believe so. We think we are catching it early on. However, it is starting to outpace containment efforts in the region. And so health experts are warning that the current outbreak, driven by the Bundibugyo strain of Ebola, could be even more difficult to contain in the past. Thus far, we have 1,000 suspected cases and 220 people have died, with 7 cases, this is in the Congo, and 7 cases and 1 death in neighboring Uganda. They are calling this outbreak now the 3rd largest in history, and the World Health Organization has declared it a public health emergency of international concern. There are currently no approved vaccines or treatments. We talked about ZMapp. That didn't seem to be as effective in later studies. They are working on some monoclonal antibodies that might help, but at this time we don't have what they're releasing to us as a best treatment or a gold standard for this. So the International Rescue Committee is warning that this outbreak could become the deadliest on record without urgent international action. They said increased conflict and cuts to global aid funding have dismantled defenses at exactly the wrong moment. The lesson from every previous outbreak is clear: delays cost lives. So the thing is, my question that always seems to happen whenever we heard, I remember during the Obama years, the FDA said, well, the reason why we're having these outbreaks, these remember there was all these foodborne illnesses, in the teens, in the 20 teens. They said, well, it's because, the FDA needs more people. And I'm like, well, what are you currently working on? So, the World Health Organization is a vast organization that has gotten millions upon millions of dollars from us and other countries. Trump starts to curtail that. And then they say, well, that's why we have Ebola. You still have the money. You still have the staff. I'm not going to, come on. I don't think we should allow that excuse where, well, we're really, really struggling because we don't have. Trump said he's not going to give, he's going to pull out or give less money to the World Health Organization. What Trump has said is other countries need to pay their share. So if you're going to be mad at somebody, be mad at the other countries for making us pay more. It's kind of, let me take a look at, just to show you how ridiculous. Oh, well, now let me see. I only have the 2026 contributions. United States is still contributing, still the leading one. Then comes China, then comes Germany, then comes Japan. And let me see if I have some exact numbers for you. I thought at one point we were giving them, I think it was, I think at one point we were giving them like 70 million a year. Or no, I thought we were giving them like 250 million. So they say in here we go. In 2025, we gave $243 million. That voluntarily. The assessed was 65 million. But voluntarily we gave more, and that was 2025. So where's that money? China voluntarily gave another 13 from their dues of 43. While the United States is told to give 65 million, Japan gave 23 with another 33. So we gave over $300 million. I don't see any other country matching that. Germany in total gave a little over 100 million, which is a lot, but still a third of what the U.S. gave. UK under 100 million. France about 43 million. Italy is assessed to only give 9 million and voluntarily add another 15 million. So that's what, $24 million. That's it. Now, I like Italians. I don't want anybody going after Italy. But, I mean, Italy is a big, beautiful country. And they only gave 25 million, 24, 25 million. You know, when you're looking at what other people are, don't be telling me that it's all America's fault. America has given the World Health Organization bank. Now, the WHO director, General Tedros Ghebreyesus, is now going to the Democratic Republic of Congo. He is asking local militias to declare a ceasefire, is pleading with young people to share what you know about Ebola, help break the fear and silence that is allowing this virus to spread. He is working to scale up Ebola diagnostic capabilities in Congo in an effort to identify cases earlier, stop the rapidly spreading disease. And President Donald Trump's administration is building a quarantine and treatment center in Kenya. Americans who are evacuated from the Democratic Republic of Congo or Uganda will quarantine and, if needed, be treated at the Kenya Center without the risks of a lengthy transport back to the U.S. I think that's a very good idea. And so in the past, what happened is we would bring them to our country, bring them back home, and then they would go to Nebraska or a facility in, I think we had somebody quarantined in New Jersey, but they might have quarantined at home. So it makes sense that we work with surrounding countries so that we have an American facility there. It's going to be expensive, but then it puts Americans at ease that people are coming, yeah. So, if somebody is sick with Ebola, because now people are criticizing Trump for that, going, I can't believe that you are not letting them travel 18 hours back home okay, if somebody has Ebola, okay, they're sick. Okay, I mean, we don't want them dying on the plane. And we've got to get them care immediately. Now, if we need to quarantine somebody, yes, we could quarantine somebody back home. Officials in Uganda ordered the closure of its border with the Democratic Republic of Congo, despite guidance from the World Health Organization. They said such measures are usually implemented out of fear and have no basis in science. But Uganda remembers what happened a few years, 10 years ago, and they don't want to take that chance. Americans who were exposed to this will be sent to Kenya for observation. It's going to be a specially trained public health service, service officers, and as we get more information, we'll share that with you. Dr. Peter Stafford, some of you asked about. He's an American missionary who contracted Ebola. He was working in the Congo. He's being treated in Germany and is doing a lot better. So that's good. Now, researchers in England, according to Forbes, say they are months away from clinical trials and animal testing that has started for a new experimental Ebola vaccine. Again, I'm wondering why the clinical trials are only going on now. I mean, we always seem to be behind the curve. The outbreaks stop, get controlled, and then we decide they'll focus on other things. And then what happened? Well, Mpox showed up, and now Ebola comes back, and hantavirus, so I think we always need to be aware. We always need to be thinking about this. One thing we have known about Ebola since it was isolated and identified in the 70s, but it was around before then. But we've known about it. We have seen outbreaks smolder every couple years. This is the third largest, but we know it's going to come back and keep coming back. And outbreaks happen when nobody's looking and nobody's paying attention, or they're not doing their job overseeing, and then people get sick, they spread it, and by the time somebody gets to the news and says, you know what, I think we have an Ebola outbreak, by then so many people have been exposed. 1-877-Doc-Dolly, don't go away.
Hi, everyone. Super Bowl champ Vernon Davis here from Legal Help Center. If you've been injured in an accident and think you deserve compensation, listen up, because we have legal professionals standing by right now to answer your questions for free. You can find out if you have a case and how much it's potentially worth. The call is free, the consultation is free, and you can speak with a live agent right now. So if you or someone you know were injured in an accident of any kind, call now to find out if you have a case and how much you could potentially get.
Thanks, Vernon. You heard it, folks. If you've been injured, call and find out how much you qualify for. Call 800-679-0800. That's 800-679-0800. 800-679-0800. Advertisement sponsored by Legal Help Center. May not be available in all states. Not available in California.
Hey, America. How tired are you of mainstream corporate media's biased narratives and manipulated news? Their dishonesty and attempts to influence this generation have been exposed, put on display for anyone who's even half paying attention. But the New American Magazine has been an honest source of news and commentary for over 50 years. This is your opportunity to receive the stalwart of principled journalism at a deep discount. Picture a beautifully published magazine arriving at your doorstep twice a month, packed with insightful stories written with integrity. It's also available digitally on the New American's mobile app. Get up to speed with intelligent coverage from a freedom perspective. Right now, for a limited time, the New American is available to radio listeners at a 25% discount on a new subscription. Visit thenewamerican.com/radio25 and receive 25% off. Subscribe today at thenewamerican.com/radio25.
Back on the Dr. Dahlia Show. Thank you all for tuning in. 1-877-Dr. 1-877-DOCDALI. Big thanks to Talk Media Network for making the show happen. Big thanks to Daniel, our producer. And big thanks to y'all for tuning in. We really do appreciate it. Don't forget to follow us on Twitter or X at Dr. Dahlia, Facebook, The Dr. Dahlia Show, and on YouTube, click like and subscribe. So, we're all worried about this AI apocalypse, and it's, I really can't stand when I see the media try to, bring on drama or like, oh, we're having another crisis, etc. But this is one of the things that I really do fear, and I don't think it could be overestimated. And there's a survey that is out, or a study that's out, that said 99% of CEOs plan on firing a lot of their workers and replacing them with AI in the next 2 years. So we're not making this up. It's coming. Let me just tell you what this latest survey shows, and then as a result, what we're seeing with employees. So the survey came from consulting firm Mercer. They polled 1,000 executives across the United States. 98% said that they have major organization design changes in the works around AI, and 99% expect AI is going to lead to layoffs within the next 2 years. The Mercer report was covered by TechSpot, and they found a collapse in worker well-being as talks of AI dominates break rooms. Apparently, they said that 66% of employees thought they were thriving in their workplace just a couple years ago. Now, 44%. Now we're seeing more workers unsatisfied. 20% of workers saying they don't have a choice. They're going to stay on as long as they can. But thinking that you're going to, be losing your job and you're going to be up a creek is doing not not a good job for the average employee psyche. In fact, they're saying that a lot of employees are now getting lazy and not caring about the mistakes because AI will now get blamed, where AI is now the scapegoat. And, interestingly, I noticed myself, and I'm not lazy, I'm very diligent when it comes to medicine, but I was working and there's an asynchronous platform where people can, with telemedicine now, with some companies, just not even talk or see the doctor. They could just input it into a computer and then a doctor reviews it. And I'm looking at the case and I'm like, I got to escalate it. I will not be able to treat this by telemedicine. This person has got to get seen. There is no way I could treat. I'm looking at this and I'm thinking it's cancer. So no, I'm not going to treat it online. But for poops and giggles, just before I even read more, because I'm looking at this picture going, this doesn't look good. I was like, what does the AI think it is? And the AI thought it was contact dermatitis, like what you get with poison ivy, or soap, like a rash from soap. And I'm like, okay, the AI is wrong. But I can use that as if anybody gets mad that I'm escalating and not treating this online. I could say the AI thought it was something that didn't match what they said. And I just kind of felt for a split second that if anybody has a problem with me having them go and get seen in person, I could just go look at what the AI thought. Yeah, and I, if you're going to be forced to have this other entity that, why not, use it to your advantage? And employees aren't too stupid. They're like, I can actually save my job by blaming everything that goes wrong on AI. Now I don't have the toxic workplace. I'm not screwing over my colleagues. We could just screw over AI. So that's interesting. But going back to this with the CEOs, 99% expect they'll do this. Listen, when you look at the headlines, there's these headlines where I think Mondami wants to pay hotel workers six figures, and New York City and LA want minimum wage $30 an hour. And we're not paying our employees enough. We need to pay them more. We need to tip more. Europe's charging for water. We're going to start seeing America charge for water. So we keep seeing these headlines that we need to pay people more. We need to pay people more, pay them more. And so why are people surprised that the employers are like, well, if we have to pay them more, we're going to need fewer employees? I mean, look at what happened with Obamacare. One of the biggest issues I had with the Affordable Care Act is it mandated employers pay for full-time employees' health insurance. So what did we see? We saw people demoted to part-time, and we saw bosses go, I'm going to then have fewer employees. Now, I'm not saying Obamacare is the reason why we have this AI push, but the more you tell an employer they have to pay, and I'm not siding with the employer, but the laws of logic is they're going to figure out then if we can't limit the amount of pay per person, then what we can do, what do we have control over? We have control over how many people we hire. And yes, people will lose their jobs. And it's going to suck. Now, will there be jobs because of data centers? Will there be jobs because, of administering the AI and computer and IT? Yes, there will be jobs. Will it be enough to replace those that are getting fired? No. Yeah, I talk to medical students all the time and residents, and they think about AI. They're not stupid. They're thinking about AI, and they're thinking about specialties. And a lot of these students are like, wait a second. If I pick something like you're doing, Dr. Dahlia, where, you're reviewing labs and you're telling people, what to do and you're giving them, that's going to be replaced by AI. And I'm like 1,000%. I go, you need to do procedures. You need to make sure you can do procedures and biopsies and things like that. If you are not doing procedures, because AI right now can't still do the biopsy. We do have robotics, and we do have, and I'm sure somebody's going to try to figure out a way to make surgery cheaper. But still, right now, even if I think there was a robot that did my hysterectomy, my gynecologist was still in the room. She was still operating the robot and still making sure nothing went wrong. And I was worried because, years ago, one of the robots was performing a hysterectomy on a patient and then smacked her upside the head. And I was like, I know this robot's going to want to do that, or I've given my gynecologist a really hard time over the last few decades, but it worked out good. But, we're telling people, make sure you do some sort of procedures because you're going to, you're going to be out of a job. And I don't like the panic. I don't like, oh, let's make this a crisis. I don't like that attitude that we see in the media, but we don't have to say it's a crisis. We don't need the media. Already workers are seeing this. And so, when I would get a job, I was like, I'm in this job for a long time. Yeah, I'm not going anywhere. And I am here and I am loyal. Now that people know that their employer is not loyal, that they are going to be out in a New York minute. There's no loyalty. And now you start to wonder how half-assed people are going to be. The more, it's interesting. Every time I write an email or I write something, my computer says, do you want AI to write this? And I'm like, no. Yeah. And people are saying, no, let AI do it. I'm like, look, I'm writing another book. I want it to be me. I don't want people thinking it's AI written. If I write you an email, this is me. But AI is even writing people's texts. One of my friends texted me, and I didn't think it was from him. I thought he was hacked because it was so beautifully written and grammatically correct. And I was like, is this you? Well, of course it's me. Why would it be any other human being? I'm like, okay, come on, man. Are you using AI to now text me? Come on, man. So you start getting lazy. And I don't want to get lazy. And as people start getting lazy, they forget what they learned. We spent, with our tax dollars for these college students, billions of dollars to get them college educated or to get people trained if they borrowed money for their trades, their trade certification and all. And just for them to be, if AI is now making their job easier, the last time, the last time I did a central line was maybe, that was like 1999 was the last time I did a central line. So that's 27 years ago. Okay. I would probably not be as good putting in a central line today because it's been 27 years. We all lose the ability to do things. And what happens when the computers are off? Now you have all these employees who have been relying on computers going, now what do I do? 1-877-Doc-Dolly, don't go away.
Looking for a gift that can actually help secure someone's future? It's Mark Falter's new book, Common Sense Income Strategies. It makes the perfect gift for that special someone in your life. Mark has helped thousands of hardworking Americans secure their financial future by using time-tested strategies that continue to create wealth, whether the market is up or down. Strategies that will make perfect sense once you take the time to read this powerful book. Common Sense Income Strategies brings to you what Mark has been teaching in person and talking about on the radio for decades. You've worked too long and too hard not to see the fruits of your labor. To learn how to receive your free copy, call 866-764-2635. That's 866-764-2635. Secure your future with Common Sense Income Strategies by Mark Falter. Again, to learn how to receive your free copy, call 866-764-2635. That's 866-764-2635.
You are about to listen to the Dr. Dahlia Show. Sassy, stimulating medical talk radio. Any medical advice Dr. Dahlia Wax gives on her show should not be substituted for an actual visit to your medical provider. And now, here's Dr. Dahlia.
All right. We are back on the Dr. Dahlia Show. Thank you all for tuning in. 1-877 Dr. Dahlia, 1-877 DOCDALI. So I wish I could, be a strategist, a PR strategist, for the Democrats and the Republicans, because I keep seeing some of these mistakes that are being made. And right now, a huge debacle is being made as it pertains to Joe Biden. As his wife, Dr. Jill Biden, who is, I believe, has her doctorate in education, is saying that when she saw her husband doing the presidential debate with Trump, she thought he was drugged or having a stroke. Now, this is not a good look. I think she's writing a book, and she's going to be promoting this book. What I would do, all right, because Democrats don't need any more attention on Biden and what happened in that presidency, and so maybe she should wait till after the midterms, or maybe after the 2028 election. He's right now dealing with stage 4 cancer. I don't like to see people badmouth somebody who is fighting cancer, but you're digging yourself deeper into a lie when you say things like that. I mean, you have a PhD, and you want us to believe that you thought that this was a one-off. I believe in an interview with CBS, Dr. Jill Biden had told the interviewer that no, she never saw her husband like that, and then she never saw him act like that since. Well, we've seen videos of them where she's had to kind of help him along, etc. And you'd never want to get caught in a lie. And so, if I was a Democratic strategist and I was trying to help them out on what do you do in terms of Biden, people don't want to be lied to. People don't want to be BS'd. And you should just come out and say, look, now he had been in politics for decades. And, as somebody ages, you're not seeing the forest from the trees. And we saw that he was starting to change. Slow down, have issues, but you have somebody with all that experience. We put our support behind him, and we weren't going to fail, him when we, put that support down. In retrospect, the American people deserved a commander-in-chief who wasn't struggling, but at the time we thought support, loyalty, and his policy was what we needed to stand behind. And we're sorry, and we're not going to make that mistake again. Now, it's not the most ideal thing to say, but it's better than, I think somebody drugged him. I mean, no. And then the idea of a stroke, if you really thought your husband was having a stroke, then you call 911. I mean, time is of the essence. If you think he's having a stroke, you call it, stop the fight. You stop the debate, and you get him the medical care he needs. See, my issue with all of this, is from a medical standpoint, I've been very critical of his family, of his team, of his doctors, because either somebody's lying or you guys did gross neglect of your loved one. And, when he leaves the White House, and within a month or two, we're being told he has stage 4 prostate cancer that's metastasized to the bones. Either you knew about it, because he is the commander-in-chief and has the best medical team supposedly in the world, or you neglected him and you didn't let him see a medical provider, or the doctor committed gross malpractice. What is it? And I told you my issue with all of this is everything is a learning opportunity. And so, when Joe Biden was going through his medical exams and things like that, people are watching. And they're like, so wait a second. So you could have memory loss. You could stumble with words, shuffle around. But I guess that isn't a neurological issue. You're completely healthy. No, we don't want to. No, if you're having a shuffled step, if you're having some major gaffes, if you're having memory loss, you need to get yourself checked out immediately. We in public health and in medicine, are trying to get people to get checked out immediately. And when your beacon of the country is struggling and not following that, people get confused. Well, wait a second. I thought that, we're supposed to do something about this. I mean, and then, why wasn't his prostate cancer found sooner? Stage 4. And they say aggressive, but that suggests he had it at least 6 months to a year. He was in office when it started. Why didn't anybody pick it up? And so now people are going, well, wait a second. I look at the guidelines where it's a conversation with you and your doctor. You look at your risk and you talk about the pros and cons. But now they're looking at it going, whoa. I don't want to one day be told I have stage 4 prostate cancer. What are the guidelines wrong? Well, I don't want you to think the guidelines are wrong if what we're being told was wrong about him not knowing. And all of a sudden it was a surprise that he had stage 4 prostate cancer. The average commander-in-chief does not have something sneak up on him that way. Even the Secret Service would have probably found it. And so, look, I feel bad for Jill. I would not be promoting a book right now with everything going on because it's now forcing her to look like she's lying. This is an educated woman. She has a doctorate in education. And you're going to tell us you thought that was a one-off? It's a teaching moment for all of us. And you could very easily save face, saying, look, he has been a 40-year decorated, politician and legislator. We felt he had the experience to run the country, and leave it at that. And apologize for misleading us. 1-877-Doc-Dolly.
Hi, everyone. If you've been injured in an accident and think you deserve compensation, listen up. Because we have legal professionals standing by right now to answer your questions for free. We'll help you find out if you have a case and how much it's potentially worth. If you were hurt in a car accident, truck accident, motorcycle accident, rideshare accident, slip and fall, or any other type of accident, call our 24/7 hotline now and let us help you find out how much your case is potentially worth. Call 800-978-6800. That's 800-978-6800. 800-978-6800. I'm Gina Hart, here with spokesman Jack Mercer. So Jack, tell our listeners who should give us a call right now.
Well, Gina, first off, thank you for having me join you here in the studio. It's always great to answer the listeners' questions. Now, as far as who should call in, anyone who's been injured in an accident and think you deserve compensation, give us a call right now. The call is free, the consultation is free, and with our no-fee guarantee, you pay nothing unless we win you money.
That's great advice. Thanks, Jack. And is it true that the Legal Help Center is open 24/7?
That's right, Gina. We're open anytime you need us, 24 hours a day, 7 days a week. So if you or someone you know were injured in an accident of any kind, call now and let us help you find out if you have a case and how much it's potentially worth. Call 800-978-6800. That's 800-978-6800. 800-978-6800. Advertisement sponsored by Legal Help Center. Not available in California. May not be available in all states.